foreplay isn't just for your partner, toys aren't just for your partner. I really challenge men's comfort zone or penis havers' comfort zone around exploring their sensory landscape. You have so much to explore. Anything can be erogenous, erotic, if you associate it in that way.
Hello, friend, and welcome to the Sex Upgraded podcast, a podcast for men all about sex, where we'll combine real, authentic, and down-to-earth conversations about sex, life, and relationships with some pretty wild personal stories and practical how-to episodes as well, with guest experts from around the world to help you have the most amazing sex life you can possibly have. My name is Taylor, and I'll be your host on this journey, and it's my goal with each episode to give you practical, actionable things you can start doing today to improve your sex life and your entire life, because a thriving sex life will help you thrive in all areas of your life. So let's begin today's episode by starting with a deep breath in through the nose into the belly together. Exhaling with an audible sigh. And let's get into today's episode. Dr. Susie Gronski, welcome to the show. It's awesome to be here with you. Thank you for being here.
Thank you so much, Taylor. I'm really happy to be here.
Yeah, I've got a whole list of questions that I think are great. Thank you, everyone who's given these questions to ask. And we're going to go into everything from Kegels, can you do too many Kegels, your prostate health, pelvic floor tightness, semen retention possibly, and all kinds of stuff. But before we get into that, I have an icebreaker question for you, if you're open to answering it. And that is, if you could go back in time and tell your younger self something about sex that you wish you had known, what would you have told yourself?
If I could go back in time and tell my younger self about something around sex that I wish I had known, it would be that it's okay to have a pleasure date with yourself without shame. That's the most important thing, because I was not encouraged to explore my body or my likes or my kinks or my dislikes. I had no idea because there was so much stigma around it. I was raised Catholic, so there was a lot of Christocentric messaging, particularly negative sexual messaging of that masturbation is bad and you shouldn't do it, especially if you have a vulva and a vagina. So I wish I would have had known that it's okay to have a pleasure date with yourself, to explore your body, to touch yourself, to embrace yourself, to love yourself with compassion and grace. And then that makes you a better lover because you know how you like to be touched. You know what places are safe, and you can clearly communicate that. And I think that's what's really lacking for a lot of people is sexual dialogue and feeling comfortable with talking about sex instead of just doing it, right? Because sex is penis and vagina, and
that's it. That's the only thing sex is, nothing else.
That's it.
Yeah, fit in the box. Yeah, that's awesome. And I think that goes for all bodies. Penis havers too, myself, pleasure dates with myself have been incredibly transformational in my life. And they're key actually to rewiring certain things around sex too.
Absolutely.
Yeah, thanks for speaking to that.
Of course.
So you are a pelvic floor physical therapist that specializes in working with men.
Yes.
How did that happen? How did you get to be here?
Yeah, that's a really good question that I get asked all the time. And I do love this question. I started my career, so I've been a physical therapist for over a decade. I can't believe I'm dating myself right now. But it was several years ago where I actually dove into pelvic health. And it was because I actually wrung out the challenges of varying different types of specialties within physical therapy. So I started my career as in the neuro realm, so acute inpatient rehab, working for a hospital. Then I went to geriatric care and vestibular care, and I had my fill there. Then I went to orthopedics, so I kind of bounced around a lot.
Yeah.
But that's not negative. Like for a long time, I thought like, what's wrong with me? I can't stay at a job for more than a year, what's going on? And it really had nothing to do with like that there's something inherently wrong with me, but it was just, I just was not passionate, about what I was doing. And I was really trying to connect with people on a different level.
Yeah.
And pelvic health was that opening for me. And so it was through my friend who we went to PT school together, called me up and said, hey, out of the blue, this is so random. And I don't believe in random. I do believe that things happen for a reason.
Mm-hmm.
And she had called me and said, there's this person by you who does at the time, women's health. Everything was kind of women centric. And you might want to shadow her. She's looking for someone to bring on for her private mentorship. It's a private practice. And I was like, pelvic health, women's health. I said, I don't know if I could put my finger up somebody's vagina or anus. I don't know if that's for, like I literally had those reservations. I'm like, really? And something just inside me was like, just go check it out. Check it out. And I did, and I fell in love with it. And here I am. So how I started to specialize strictly working with men was the bravery and the courage of men reaching out for help. I mean, that was, I did not have male-centric language on my website like I do now. It was really kind of gender neutral, more so I think women-centric. But men were reaching out to me asking, I have these similar concerns. Do you think you can help me?
Yeah.
And then I was like, yeah, why not? As Emily Nagoski would say, one of my favorite sex educators, she would say, we all have the same parts, just organized differently. Mm-hmm. So why not? And so I started to welcome men into my practice. And then I started to listen to their stories, listen and hold space. And I recognized very quickly that there is definitely a gap here as far as access to care, a safe space for men to reach out to, and to get accurate medical information and advice on what to do if you have sexual pain, dysfunction, all of the above, urinary complaints. They didn't know who to turn to. And then it wouldn't be until several years later where they would actually connect with someone like me. So that to me is unacceptable. That is not care as far as like a model of care. Yeah. Men should have spaces that reflect who they are, speak their language, feel that they can talk to you and that you won't be judging them or that you won't feel embarrassed because you're talking about sex. I mean, how could you do pelvic health work and not talk about sex, or be a urologist or a gynecologist or, any provider for that matter. Do you know what I mean?
I don't know. I don't think it would be possible.
It's like, but we're not, no one, it's not in the educational curriculum.
Yeah.
Health providers across the board are not being taught about medically accurate sex education. And that's a problem.
Yeah, it is a huge problem. And it makes me think, when I was looking at your website before this interview, I saw you have a Venn diagram on your website that has 4 different things on it. There's mental, there's spiritual, physical, and then you have sexual as the 4th Venn diagram, and they're all interconnected. And I thought, holy shit, I don't know that I've ever seen this on a medically based provider's website, that they're actually seeing sexuality as an important part of a holistic lifestyle. And so, I wanted to ask you about that.
Absolutely. So this is going to be a 2-part answer. The first answer is, when you look at Maslow's hierarchy of needs, I'm not sure if you're familiar with that, the very bottom foundation that the whole pyramid is built on is food, water, shelter, sex.
Yeah.
It's a basic physiological function and need. So important. So that's one. The second is the World Health Organization actually recognizes sex as part of health.
Really?
And so that is where my inspiration came from. So in fact, I actually wanted to read directly from their website, their current working definition of sexual health. And here it is, because it's a beautiful one. Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity, which is physical or mental weakness. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled.
That's good.
I get goosebumps when I read that.
Yeah.
Every time.
That's beautiful. And I've never heard that before. And it makes me think, wow, if that's the World Health Organization, that's their definition of sex, like what's happening?
Where did we go wrong?
Yeah, where did we go wrong? What's the deal with most of the other medical providers, at least in my personal experience? You know, like that's a big philosophical question, but my curiosity goes there.
Right.
You know,
right. Yeah. Yeah. And it really, for me, it's like, it's the evolution of a culture, of a society where these are constructs, negative sexual scripts and messaging, which are all constructs, made up constructs.
Yeah.
That then we as a society and culture indoctrinate and think that that's quote unquote normal and that things should be shamed or embarrassed in some way. And that's when we get into trouble. So,
yeah, man. All right. Thanks for that intro. That's awesome. And that's, I think maybe we'll include that quote on the show notes page because it's good. Maybe a link to the World Health Organization. Maybe not. So next question for you. In your practice, what are some of the most common reasons men come to you? Like, what are some of the most common things you see?
Yeah. So the most common things that I see in my practice are pelvic pain, also can be sexual pain. So when I say pelvic pain, the definition, according to some literature that you might read in research, is having pain in the abdomen, the genital region that lasts greater than 3 to 6 months, that is not of known pathology. So there's no infection or other red flags, that all that has been ruled out, but it's persisting. It can lead to urinary dysfunction or complaints like urinary frequency, urgency, bladder pain. You also might have bowel dysfunction, so difficulty going to the bathroom, painful bowel movements, constipation, diarrhea, etc., abdominal pain, groin pain, testicular pain, penis pain, anywhere in between the butt bones, basically. Yeah. If anything hurts, because it shouldn't hurt, that area is usually an area of pleasure and joy and connection and identity in a positive way, I would hope. But when pain starts to creep in, it's certainly alarming for a lot of us because, again, it's if you hit your thumb or you hurt your elbow or your foot in some way, you can go around showing people, asking people for their opinion. But what happens when your penis hurts? You're not, maybe you might feel comfortable. Maybe you might, don't get me wrong. Maybe you might feel really comfortable to ask your friends or, go and be like, hey, take a look at this. What's going on? Yeah. But it's so important for reassurance. Like, again, if something hurts, you want to be able to touch it, to see it, to rub it, to share, to ask questions. And that's just not happening. So what that does is increases the anxiety, increases the worry, increases the stakes of what's going on. And that in itself can amplify the pain response. So, when you ask me what people coming in to see me with, sure, they have the physical pain, but there's also the emotional pain that they're experiencing and the anxiety and the worry and the distress and the suffering that comes as a result of this change in their life, in a body part that used to function and operate, and they used to connect with in a way that was, wholesome and embracing. And now it's like there's a disconnect.
Yeah, and in hearing you say pelvic pain is a 3 to 6 month thing with an unclear cause, my mind is thinking that's really a long time to have pain in that region without, doing anything about it. And when I heard you speak earlier, I heard you say like some guys go for a really long time.
Mm-hmm.
And yeah, that makes sense because we've, as guys, have received the programming like, oh, you've got to be self-sufficient. You have to do everything yourself. You have to be fine, be fine,
Mm-hmm.
especially in this region where there's so much baggage and shame. Reaching out for help. Whew. And it seems really important to do so.
It does. And I believe, now I don't have any research to back this up, but I believe that if we, as a community, medical community, were to offer, what happens usually with men who have pelvic pain or chronic pelvic pain syndrome, it's another name, or chronic prostatitis, there's so many labels, but no one can conclude on one definition because there's many different factors that might contribute. Anyway, they go in with these symptoms, usually see their primary care provider or a urologist, and the urologist will say, okay, let's do a urine analysis. They might test the prostate fluid. They'll do a digital rectal exam to, palpate the prostate or touch the prostate. They'll rule out the red flags. Nothing is showing up. So at that point,
you're fine.
You're fine.
Yeah.
It's all in your head. That's the message.
Yep. Go home.
Go home. You'll just deal with it. You're going to be fine. It'll go away. And there's no actual, let's sit down and talk about contemporary pain neuroscience and perspectives of why you're hurting. Sure. Maybe it did start with an injury. I mean, are doctors asking you about so masturbation styles? Let's talk about that. When did this pain talk? Not that masturbation. Don't get me wrong. I don't want the audience to think masturbation is bad or that it causes pelvic pain. No, It doesn't. We can get into that. But it's asking about, well, what are some of the triggers? What has changed in your life? Is there perhaps there's some tissues that are injured or irritated, or you tried something new, but you're not asking those questions. And it could be such an easy, a thing to address of how about you try some lube, decrease the friction, or lighten up your grip, or, just things like that. Yeah. So again, we're not asking the questions. We're not getting the whole picture. And in fact, we're not treating the whole person. We need to, you're just looking at it from a very myopic lens where you actually need to take your lens and increase the panoramic view to see the entire person and treat the entire person. So that's a person-centric approach, not a disease approach, which this isn't a disease, this can be easily workable. It's just that we're not treating pain in an efficient way. We're not helping these guys in an efficient way. And then that's where that perpetuates to chronicity, because they're often, again, like I said, they're often dismissed, not validated, and are off to fend for themselves, to look in the weeds for help.
Yeah. It reminds me, about 4 or 5 years ago, I actually went to a urologist in Asheville because I had something going on and I was concerned about it. Turns out according to this person, it was fine. I think it's fine now too. But the visit was ultimately just really unpleasant and disconnective, and there was no helpful conversation at all. They just said, oh, are you experiencing this? No. Check, check, check. No. Okay, you're fine. And that was basically it, exactly what you're saying. And while the person was walking out the door at the end of our visit, they said, oh, by the way, you should probably get a circumcision because most women will like you more. And then the door shut. And I was like, are you fucking kidding me?
You can't make that up. You just cannot.
No, it's real. And it's happened in Asheville 4 or 5 years ago.
So sorry you had that experience.
Thanks.
That's inappropriate.
Yeah. But this is the thing. This is what a lot of people experience in this world, and it was shocking to me at the time. And luckily I've done enough research around this that it didn't stab me, or it didn't, take away from me for a long time. But it definitely, the impact was more the realization of, wow, this is the paradigm you're operating under, and you have no personal connection at all here.
Yeah.
So I think we could talk about that for a long time. Philosophically, what's going on in this world. I'd like to get into some specific topics. And you kind of mentioned one earlier, so I'm going to shift the order up here and ask a kind of, abrupt question. Can you break your penis? Is that possible?
No, there are no bones in the penis. So you can't break your penis. However, you do have ligaments and other tissues that may get injured. So no, you can't fracture your penis, but you can certainly injure your penis just like you can injure any other part of your body. There's soft tissue structures, there's nerves there, there's ligaments that help suspend your penis and help with rigidity. Like it's called the suspensory ligament of the penis. Essentially, that is a very tough ligament and it helps for rigidity with erection and so forth. So when folks choose to have penile, I guess, cosmetic surgery or enhancement surgeries, this is usually the ligament that the doctors will cut for the illusion of length. Yeah.
Interesting.
So
if I'm having penetrative sex with somebody and there's sometimes you can like stub your penis, or get caught at a wrong angle and it hurts and it maybe hurts for a couple of days. It might actually, I guess the medically accurate term, would that be a sprain?
Yeah.
Would it just be injury?
Yep.
Sprain.
Yeah.
Okay.
That's
so you can sprain your penis.
Yeah, a tissue injury, right. And the nerves of the penis can get irritated and you might have swelling and so forth, just like any other part of your body. And the more that you know about the part of your body and familiarize yourself with your own anatomy and how it works, the less scary situations are because you have a deeper understanding of your own biology, which is so empowering for all of us to know about our parts and how they function and when to seek help and when you can kind of take a back seat and wait it out. So I think empowering people with knowledge like you and I are doing here on your podcast is such a beautiful thing for people.
Yeah. Thanks for saying that. And I think so. And that's why I'm here. And that's why you're here. And so I guess, if I sprain my ankle or my arm or something, I'm not going to jump right back into doing the exact same thing I was doing. So maybe similar. Might not jump right back into full on penetrative sex. Maybe wait a little bit, maybe do some self-massage.
Exactly. Self-massage, breathing, relaxation techniques, movement, keep your body moving because all tissues crave blood flow, movement, and space. And that's how tissues heal. You might, rest maybe for a couple of days, but start getting back into self-touch and, engorgement of those tissues because that your penis has a function, just like your hand has a function. And if you stop using it in a certain way because there's some fear around getting back to activity, right? Athletes do this all the time. Like, excuse me, if you have a hamstring strain, a couple of days of rest, but you're right back training and stretching and loading that part of your body in order for it to heal. So we do that all the time for other parts of our body for rehab. Again, it's not easily talked about when it comes to our genitals.
Right.
I think that's a big gap that we're up against.
Yeah. And even in the sports world, when people get a massage, we're getting massaged on our entire body. And even in therapeutic massage, it's everywhere except for the genitals.
I know.
And that's a whole other rabbit hole we could go down. And it's a big bummer in my opinion too, because wow, what would it be like to actually receive therapeutic touch there that's nurturing, that doesn't have goals or sex attached to it?
Thank you.
Yeah. And so, maybe this is part of some of the things you help guys with. And if you're a guy listening to this, I encourage you to try just massaging yourself therapeutically, not in a masturbation context, but just see what it feels like to touch yourself there with the intention of self-healing and therapy and nurturing yourself. It's pretty amazing.
It is pretty amazing. It's not performative based sex. What you're talking about is pleasure oriented sex and touch. I mean, doesn't the sex in itself is a term that I think is defined individually. Like, what is your definition of sex? What are the values around sex? Like, what does sex mean for you? And then expanding that box. Oftentimes my work is to help men like view sex other than hard, rigid erection, ready for penetration at any time. Instantly, which is a huge myth. It is a huge myth. And, foreplay isn't just for your partner, toys aren't just for your partner. I really challenge men's comfort zone or penis havers' comfort zone around exploring their sensory landscape. You have so much to explore. Anything can be erogenous, erotic, if you associate it in that way and like allow yourself permission to just bring your mind inward and notice and feel without all the baggage. or the pressure to perform or to show up in a certain way, because that is a major boner killer.
Totally. Yeah. So let's talk about that. Erectile dysfunction.
Yep.
Pelvic pain, I'm sure, contributes to this. Anxiety contributes to this, but is this something you help people with in your practice?
I do. Yeah, I do. And yes, pain can be a contributing factor. Performance worry, anxiety can be an attributing factor. I like to tell, so all the men out there, that erectile failure in your life, throughout your life, is common and normal to experience that. It can be one time, it can be 2 times, maybe even 3 times, or maybe more. Mm-hmm. The difference here is that when those issues, or when that erectile failure becomes persistent and consistent and is also distressing for you and or your partner or partners, then that becomes, a sexual dysfunction. It's not a disease though. Mm-hmm. It can be influenced by certain diseases like cardiovascular disease or diabetes, also being on certain medications, for example, like blood pressure medications or benign prostatic hypertrophy, which is enlarged prostate medications. There are lots of medications that have sexual side effects that many people are not aware of. And my job is really like looking up, I'm like a pharmacist too. I'm like busting out my pharmacological reference book and really just reading like, hey, did you know that this particular medication can cause all the symptoms that you're coming in to see me with, So again, empowering people with knowledge and resources, other factors like smoking, again, which leads probably to cardiovascular disease and diabetes, sedentary lifestyle, exercise, things like that. So there are many hormones, another one, but there are many factors that could contribute to someone's sexual dysfunction. And no one size fits all. And it really does take an individualized approach to, tease out what factors of their sexuality are being influenced, not just from the biological perspective of which we're talking about, right? The hormones, the heart health and diabetes and so forth, but also from the perspective of the psychosocial factors, the psychological factors, the social cultural factors, and the interpersonal relational dynamics, which are huge when it comes to erectile functioning or difficulty. Is what's going on up in this head up here while you're engaging in a sexual encounter, because the older that men are, and this is in literature, but also just from anecdotally from my experience of working with men over the past several years, is it's often the psychogenic factors that are weighing much more heavily in that sexual encounter than the biological. And that makes sense to some degree, because the biology, when you're younger, like when you're in your, teens, 20s, 30s,
it's on.
You're riding the rails of your hormones and, everything else. And it's a novelty too, it's like everything is new and exciting. It's very different when you're older or in partnership for a very long time. Often couples will find themselves doing the same old thing and in a rut. And I have to tell them, like, think about having the same meal for 30 years. Chicken rice, tofu rice, salt and pepper. And you've had that for 30 years.
I think I lost a little bit of my appetite there. So it sounds like a huge percentage of these cases are psychological. And I can't necessarily speak to like what percentage of like for what person, but it always has an emotional, psychological component, because that is part of our biology. Our thoughts and beliefs shape what our body does. It's like microsurgery for your molecules. And the best example that I have for this is, have you ever thought of something that was sexually stimulating or erotic, and like all of a sudden you started to have genital arousal? Like a thought, or maybe a scent, or even subconsciously you just have an erection just pop up out of nowhere. Okay, right. There was no genital stimulation or touching, right? But you still had these reflexes kick into gear. Well, that example right there shows you that the flip side is also possible.
So what you think, what you believe, what's going on in the sexual encounter or solo or partner as far as play, like those thoughts and beliefs and the pressure, we talked about the pressure to perform, if that's in the forefront in your mind, or you're trying to rush through, your sexual your sexual session, you're trying to rush through because, oh my gosh, if I don't hurry up and penetrate, I'm going to lose my erection, right?
Yep.
You're actually adding fuel to the fire. You can't force an erection to happen.
And stress is, it's like the killer of arousal.
100%.
Right? And actually the ability, physiologically speaking, to maintain an erection.
100%.
Yeah. So I'm interpreting as what you're saying. You didn't say these words, but instead of a guy possibly going online and trying to get a prescription for Viagra and loading up on Viagra when they've been in a long-term relationship and the erection isn't happening as often, maybe instead take a step back and look at your life and your relationship and the quality of interaction there, and whether or not you've been eating chicken and rice for 20 years straight, something like that.
Not that there's anything wrong with chicken and rice or with your partner. It's more about the spicing it up, adding different flavors, expanding your sexual repertoire. And what I've noticed is that it's normal for couples to kind of fall into this very traditional style of life gets in the way and sex is on the back burner. But research shows us that 10 to 15%, like sex enhances a relationship by 10 to 15% just by having a healthy sexual relationship, if you're in partnership, of course. Right. And I get that there's, our bodies change, circumstances, right? We might have surgery, or we might have, cancer, for example, prostate cancer or something like that would require surgical intervention, radiation, and that impacts biologically what happens to the structures that supply your penis. And that might actually create an issue, right? The nerves of the penis are compromised. So you definitely need to have an intact nervous system, intact blood flow for those parts to function. But that still doesn't mean, even if the penis, if you're not able to have an erection, you can still have an orgasm.
Yeah.
You don't have to have an erection. And there are many other ways to artificially help support that. It doesn't have to be sterile and medical. I often tell people, like, let's bring in some sexual aids, toys, or what have you. Like, how can we involve your partners, yourself? How can we reconnect with your body in such a way that's going to allow you to embrace, embody, reconnect with your sexual identity? Because so many men, like, penis identity is part of their their masculinity, or their I guess their how they would view their own masculinity, I guess. And again, I'm speaking from more of a male-centric, hetero, I guess, normative language. So I apologize for that, and I totally get there's much more to this conversation as far as that goes. But yeah, from the people that I work with, there's really this heteronormative, I guess, way of thinking or attitude around sexuality. And
these are the clients that often come to see you.
Yeah.
It's really interesting having this conversation right now. I'm recognizing, yes, you are a pelvic floor physical therapist and you do hands-on therapies for people. And there's so much more than that. It sounds like you're also doing some form of counseling or conversation with people. And that's actually a huge component of it. People don't say, oh, I have this problem, come in and you do some manual adjustments with your toolkit or whatever, and then they're fine. You also need to talk about this with people and have these kinds of open conversations. And that becomes part of the therapeutic process also.
Exactly. And not every physical therapist has. So I went to the University of Michigan to get a year-long program with them for their sexual health certificate program. So I actually do have sexual counseling and education as part of my toolbox. It's just why it's, I have the training. But I will say this, that not every pelvic therapist has that knowledge set, or the comfort or what have you. So
man, it seems like it should almost be a requirement.
I agree.
To be able to go in there. Because I think back to times, and I'd like to go into some of the biology here, but I think back to times, at one point I was in this very different from what we're talking about now, a non-medical, but a retreat type setting where there was somebody who, for the sake of this workshop exercise, they had their finger inside me, and it was therapeutic sexual, I guess you could say. And what happened for me is, while they had their finger inside of me, there was this spot inside of me that felt extra tight and kind of burny. And they just kept their finger there, and they weren't touching my penis or stimulating me in that way. But I was breathing deeply, and I had all this emotion come up out of nowhere, and just like started crying and bawling, and then realized, holy shit, this thing happened when I was 5 that I had been carrying this whole time, and it somehow was like inside me, and I'm just imagining, if you're going to be doing this kind of work with people, like, you've got to be, I would hope, at least understanding that kind of stuff could happen. But that brings up so many other questions for me. And what I'd like to go into with you is this internal realm, literally biologically internal. You do work with people internally, and there's so much that can be held there, not just physically, not just, oh, you have pain here, let's touch this, massage this, you're fine. And so I'm curious to start, how does that happen? Or why does that happen? Why, I don't know. Does anything feel inspiring to talk about from what I just said?
No, and I just want to say and acknowledge, thank you for sharing your experience, because it's important to acknowledge those parts of ourselves that might show up in such a very intimate therapeutic setting. I'd like to say that we're so, sometimes medical providers are so quick to sexualize things, where in fact, you have a human being who has human experiences throughout their entire life that they may or may not remember. And we should be informed individuals to help support or just hold space. No one's saying that we have to fix their issue in any way. That's not our role. But it is our responsibility to hold space, to empathize, and to have compassion in those moments. And that is with our touch. It can also be with our touch, as you're alluding to. Touch not to poke and prod and fix and, oh, here's a muscle, let's stretch the hell out of it. No, it doesn't work. Like pain and sexual dysfunction doesn't work that way. What we're trying to do with our hands is not to fix them, but to support them, to support people, and to communicate with their nervous system, their biology, their brains, and of course, on so many other levels energetically that I just don't know about, So I'd like to think that when we do anal rectal work, or that we are, whenever I put my hands on someone, it's always with consent, and it's also with gentleness, because I know how I would like to be touched. And even though this is a medical therapeutic setting, that doesn't mean you leave all those factors at the door. In fact, all of those elements really matter, more so much than what you're doing or the technique you're using. It's about, have you created a safe container for that, for this interaction to happen? And so safety cues are important, and holding space and communicating, looking at that person in their eyes and regulating with them, I think that's just such a powerful tool when we're talking about manual therapy and touch. That's really powerful.
Yeah, it's really powerful. So question, have you had men that you've been working with that have had these emotional releases in your practice?
I have. Yeah. Many, many, many times. Many times. And they themselves are surprised. Their tears, sometimes their body will shake. There'll be like, it might be a trauma response, honestly, for some. And there might be some fear, or there might be relief, and I just stay curious. I acknowledge that this person is processing in some way. And I say, how can I support you here? Would you like me to give you some space physically and certainly in the room? Do we want to just sit here and be with this for a moment? And I'll help, guide you through some just breathing and self-soothing and so forth. So I really think it's so important to allow our patients, or the people that we're working with, to guide our sessions, to be the ones to tell us what they need instead of us having the agenda. Because often, as you said, medical providers, your experience was a perfect example of that. Checklist, did I get this, and this? Okay, good, you're done, out. 5 minutes later, their hands on the doorknob and thinking about the next patient. And that is what is lacking.
Yeah. And so in these men, well, just to drive the point, and you've had lots of people, lots of guys that you've worked with have this experience. I think that's important to note. This is a common thing. And B, have you found that in this sort of psychosomatic release of that experience, like that in itself has been a big healing opportunity for people, or you've noticed shifts in these guys afterwards?
Absolutely. Absolutely. Like just from a physiological standpoint, their nervous system is reorganizing in some way. And when it comes to pain in particular, that's super important. That release, the discharging of negative energy, the physiological relaxation that their body then goes through. Obviously, there's new patterns being created neurologically. And, often we'll find ourselves in habitual ways of moving and, tensing our body. It's like a guarding reflex. And if we can work to dismantle that a little bit and create some ease, that is healing. That helps to decrease immune responses, inflammation, neural upregulation and sensitivity, muscular guarding, et cetera, et cetera.
Yeah. Muscular guarding being tightness.
Yes.
Pelvic floor tightness.
Correct. Yeah. Tightness, scrotal lifting, the scrotum will feel tense and lifted, almost like, their balls are going up into their abdomen, the penis feeling like withdrawn in, like just tight and tense. Yeah. Buttock gripping, anus squeezing, yeah.
There's this part of me that's feeling the call to say something like, all men go out and explore your assholes.
Yes.
Yes. Yeah, there's some blanket statement in there that I'd want to make. But I think a really important point here is to notice that this is a really common experience for guys coming to see you. And for a lot of us guys in society, like I mentioned earlier, we're holding a lot and we stuff down our emotions a lot. We don't often let ourselves cry. We don't often even ask for support. And a lot of times that does end up stuck in our body. And for whatever reason, it really seems like this region houses a lot of that stuff. And again, for whatever reason, when it starts to be explored, it could be pleasurable, but also it could be painful. And also it could provide a really incredible transformative experience for you, where you release something that maybe you've been holding for 20 years.
Oh yeah. Yeah. And there's so much fear and repression. There's a book called, I don't know if you've heard of it, The Body Keeps the Score by Bessel van der Kolk. Exactly what you're alluding to is the body does keep the score, and our emotions do shape and shift our biology. And emotional regulation or discharge, or just trying to help someone move through experiences, right? Pain in itself in a region that, again, you're not talking about. No one knows what's going on. There's so much uncertainty. You don't know if you're going to be one of the guys that are going to be living with this for the rest of your life. I mean, it is like detrimental. In fact, men have reported that having pelvic pain or chronic pelvic pain syndrome is right up there with experiencing a heart attack and having Crohn's disease.
Wow.
I mean, it's a big deal.
That's huge.
Yeah. So just telling people, just live with it, I don't know what's wrong with you, is not acceptable.
No. So yeah, it's not acceptable. So if there's a guy who's feeling like they want to explore this, not all the guys listening are going to be able to fly to Asheville to have sessions with you. Like, what would you suggest a man do to explore this on his own, either in the context of self-pleasure or self-therapy?
So a couple of resources. I'll say the first being, sex therapists, sex counselors, and educators, they do have to go through extensive further education to be able to use those designations. So they do have, just depending on the curriculum, but most curricula have the biology, the science, the education to help support someone through self-touch and self-pleasure and et cetera. So having someone like that to help guide and coach you, it would be phenomenal. So you can use a website called asect.org. It's AASECT.org, and find a professional there in your area. You could also look for a pelvic therapist like myself, and that could be through pelvicguru.com. The American Physical Therapy Association Academy for Pelvic Health also has a directory to find someone in their area. I I strongly encourage folks when they're looking to connect with someone to have a conversation and consult with them first to see if they're a good fit. The conversation that we're having would be a really good, I guess, framework to have as far as like, oh, the person that I'm going to see, are they comfortable talking about these things? Do they understand where I'm coming from, and can I trust them? That's the most important thing, I think, is trust. Can you trust that person with your story, with your body? Or are you just going to be another number, and that does take courage to pick up the phone, to make that consult call, or to call them and ask to speak to someone that, you would like to talk to address your concern. So I think, being your own advocate and empowering yourself to just, initiate that phone call and have a conversation. The other thing is certainly if someone's interested in working with me directly, many different options to do that, because I realize that there's such a need for this outreach, and not everyone thinks and approaches things like I do. So there's ways to connect with me. I do remote consultations and coaching, sexual coaching, pelvic health, and a combination of all of that, certainly in person, as you alluded to. And I also have an online program. So it's specifically for men who are experiencing pelvic pain, but that program also is a community. It's a community where men can have a safe space to speak with each other, to connect with each other, to celebrate their victories and accomplishments. And social support and connection is very important as far as prognostic factors for recovery. Positive social support is important. So, my goal here, the idea here, is to help empower people through connection, through resource, to knowledge, and really build resiliency in this community.
Awesome. And do you encourage men to explore anal pleasure on their own? Do you encourage toys, self-touch?
All the time.
How would you encourage them?
All the time. So, first when you're doing a sexual history or intake, right? It's you're not making assumptions, certainly. So you're starting off with the most generic questions, and you kind of go into the deeper questions of, I'm going to be asking some sensitive questions around your sexuality. Please feel free to answer as little or as much as you'd like, certainly. And also normalizing that conversation and saying it's okay for you to talk about this. But, asking about their sexual preferences. Sometimes I'll walk people through, like, what's a turn on and what's a turn off for you? What accelerates your engine and what kind of puts the brakes on. And that's a therapeutic exercise just in itself, because that'll kind of show you as the provider of like, well, what have they been trying, and what are they thinking about, and what are they willing to explore with? So, I ask, how do you feel about anal play? What's your experience with anal play or penetrative play, if that was, or prostate play, for example? What's your experience with sex toys or sexual aids? I kind of use language differently just depending on who is in front of me, and you can gauge, how comfortable they are. And a lot of people, rightfully so, are very nervous to be in the hot seat. So, my role is to really help to land the plane with them and know that it's okay to talk about these things, and then they'll kind of warm up and open up. But yeah, it just really depends on that individual, what's on their sexual menu, and if they're willing to explore to explore beyond their current sexual menu, to add to their repertoire as solo or in partnership. And often I will involve the partner and have couple sessions to see, like, where's red, where's yellow, where's green, as far as where do you want to explore. And for pain, it's really important for guys to explore their own bodies, because they need to be able to guide their partner to say, I really would like it. Like, I would love for us to use this position. Can you go slower, maybe firmer? Can we, use this toy? Can I stretch my legs this way? Can you massage like around my anus? Like, it doesn't have to be like medical. How can we incorporate pleasure to basically inhibit pain?
Yeah.
And that's so powerful. So yeah, I am such a proponent of toys and vibrators or vibrators. I have a whole drawer full of demos that I use.
Awesome.
Lube is a toy.
Yeah.
How many men, like, I can't tell you how many men I talk to and say, like, no, I don't need lubricant. And I'm like, hold on a second. It's a sensory.
Have you tried it?
Have you tried it? Like,
it's pretty great.
Yeah.
It's pretty great.
Yeah.
Maybe we'll put a link to, I'll ask you later, some of your favorite toys, or we can put a link in the show notes as well. Vava
Boom Asheville is a great
They are.
Great boutique here in town. I'm from Chicago, and I've been to some sex boutiques myself there, and I cannot tell you, this little town in Asheville, va va boom, you rock, because they have the best quality and the most sex positive as far as their mission, their values, their education, their community outreach, like phenomenal place. So anyway, that's my,
it's a good
shameless plug for
Thank you.
Va Va Voom
Yeah, I've
Asheville.
bought a lot of stuff in Va Va Voom. I think it's great. If you have a local sex shop, definitely try to support that for sure. All right. A couple more topics I want to go into here with you. Kegels, tight pelvic floor, and this concept of semen retention and blue balls. And I think we have enough time to do it all. I'd like to.
No pressure. Remember, this is a no pressure situation.
So let's talk about Kegels. Kegels are everywhere on the internet right now. It's kind of the cure-all to everything, it seems. I see, for those of you listening, she just like did a gesture of like, oh, disappointment, put her head down. But I see them everywhere. Like Kegels for this, Kegels for that. Kegels will improve everything about your sex life. So I'm going to ask you, is it possible to do too many Kegels?
So Kegels, I have a love-hate relationship with them. And Kegels are pelvic floor contractions, right? They may be appropriate for some situations, like if there's true weakness, right? And then they may be appropriate. But if you're dealing with pain or premature ejaculation, not helpful in the beginning. Though we do want to get to intentional and purposeful coordination and like motor control and exercises, certainly. We don't just not do those things because it's not functional. Like the muscles around the base of the penis, their job is to squeeze and relax to help with ejaculation. They also help with maintaining an erection and rigidity. So, we need to get back to function. So, but initially Kegels might not be the thing for you, right? There is no number as far as how many are too many. There isn't. It really depends on how quickly this activity and how much is being introduced, and can your body handle the tissue demands being placed on it and adapt over time? What happens is people do too much, too soon, too fast. And that's like with any exercise, right? Yeah.
And then they get tight.
And then you get, So you get tight, or they're just focusing on the squeeze and not being conscientious about the letting go. Because in order for you to open a lid or open the door, you have to open your hand, and then you use your hand to squeeze and turn. But you can't do that with your fist closed. So you have to let go to have an efficient contraction. So it's about the squeeze and also about the letting go. So coordination. Yeah.
So you might not want to start off with a ton of Kegels if you're already tight in that region, sounds like.
Yeah. Right.
That's a huge thing. And I've heard from a lot of guys who they'll email me. They've never done any of my programs, and they just have read about Kegels or learned about them. And they've said, oh, Taylor, but I've been doing Kegels for 2 months, like all the time. And I'm still struggling with premature ejaculation. Why? Like what's happening? And then I'll ask a couple other questions about the tightness in their pelvic floor. And they realize, oh, wow, I am like just totally constricted in that region. And I like how you spoke to it. The relaxation is really important too.
So important. So important. And I like to also plug this, if I may, about like tone or, hypertonicity of pelvic floor is an old term. So it's still circulating, but we've since moved away from saying hypertonic pelvic floor because there's no neurological issue like having a stroke or a brain injury that would actually change tone from that perspective. We're starting to move towards overactive or non-relaxing pelvic muscles, which are driven by reflexes of the nervous system. So people will often come to me and say, my pelvic floor is really tight. My pelvic floor is really tight. And it's like, okay, I got to like stretch the muscle. I got to do this to the muscle. I got to do this to the muscle. And it's like, well, what about everything else that's like, that's contributing to this like descending facilitation of this reflex of guarding. That's right. Like, and again, it's like recognizing that it's not just it's not a muscle pathology that we're dealing with. It's a protective response in some way.
That's huge. That's huge. And I think we live in such an active world. There's so much going on. So many of us work so much and we're constantly stimulated by all these things and we don't take time to just relax. And so that ends up we have a massive, I think, tight ass syndrome
Yes.
in the world, and this is something that happens.
Yeah, it does. And, when someone does an assessment, for example, of the pelvic floor, we don't have gold standards of, what's too tight?
Yeah.
Because we don't have what's normal.
Mm-hmm.
So I'd like to demystify this on your show here once and for all.
Yeah, let's do it.
As far as, when somebody says, oh my gosh, I'm too tight. And again, trying to pathologize muscle, we don't have, we as clinicians, and I say we don't have a gold standard of measuring tightness. There's no normal, there isn't. And what we feel on your body is subjective. So we can't really equate muscle tightness equals pathology or dysfunction, because I have tight hamstrings and I can do yoga. In fact, I did it for a whole month of every day studying, doing my yoga teacher training. Mm-hmm. I didn't grow 5 inches and my legs didn't get longer. And in fact, everything's still the same. Everything's still the same. So there's neurophysiological adaptation processes that happen that contribute to changes of how we feel in our body. And again, that ease, but that's really that's definitely a conversation for another time. But your brain, it has a lot to do, and the context has a lot to do with how comfortable you feel in your body. And the more we resist something, or the more that something is scary or unknown or exciting, then that's going to change, obviously, the motor output or the output response on many different levels. So
sounds like we all need to be breathing more deeply
and
taking a pause. So maybe let's all take a deep breath right now. And relax your pelvic floor.
That's right. Let it go. Let it flow.
Yeah. But don't pee your pants.
Right. Well, thank goodness
Preferably.
for the pelvic floor.
So, have you heard of this thing called semen retention? And do you encounter men who come to your practice ever that say they're doing this?
So I would like to ask you to help me understand what you mean by semen retention, because I have heard a couple of different things. For example, some men will define semen retention as their client, the ready to ejaculate climax, they'll actually physically stop the semen from coming out of their penis by squeezing their penis in some way. Others call this edging, So I would like to know what you mean by when you ask me what semen retention.
Great. Well, this is a cool first test, I guess you could say, because there's a ton of guys out there on the internet watching videos about semen retention all the time. And I think a lot of different ideas about it, and that you don't have a clear idea. It's indicative of the nature of the thing. So in this context, it could mean any number of those things, right? But specifically, I'm talking about a guy who chooses to intentionally not ejaculate for a number of days, an extended period of time, for the sake of whatever mental, psychological, physiological benefits that they would get from that, even if they're having sex during this time.
Okay.
And maybe that includes them not ejaculating during sex and squeezing and stopping that. But ideally, it doesn't involve having squeezing to the point where you actually have a retrograde ejaculation, which goes up into the bladder and is not actually semen retention anyway.
Right. Exactly. So it's usually not a common thing that someone will come to see me for unless something starts hurting. So I will share with you from my perspective of this practice with congestion, or because what happens is you still have all the physiological happenings, like the contraction of the tubes, again, your prostate, fullness.
Are you speaking to when you're being sexually active?
Yeah, when you're aroused, I guess I should say, when there's a psychogenic or genital stimulation or arousal, there's all those reflexes are kicked into gear, right? And so there's a natural process and flow to that. So I'm here there's not a right or wrong with this. It's really, again, goes back to how gradually did you introduce this practice in your life?
Yeah.
And did you approach it from a start slow and then build up? And that's where people get in trouble in my experience clinically, is that it's a practice of too much, too soon, too quickly, where their body just isn't able to adapt to the tissue demands that are being placed on it. And that, again, whether that's muscular, it's all it's muscular, it's erectile tissues, the testicle itself, the vas deferens, the prostate gland, the ejaculatory duct, all those structures are regulated by the autonomic nervous system, and some are not under your control and others are. And so again, I don't think this is a black and white answer, so to speak.
Yeah.
And there's a lot of gray. Did we just gradually start to introduce this practice slowly? And if you give yourself time to adapt, there shouldn't be any issues. And in fact, people find it very, very erotic and helps, with their sexual energy and, and also helps with ejaculatory volume and force. Cause that could be very pleasurable for penis havers of building that. So anyway,
so it does. I think it's a really helpful, important piece, at least to hear this from you, who's somebody who's studied the medical model of things in depth as well, that if you're a guy who's used to maybe ejaculating every day, probably not the best idea to just stop cold turkey and try to go for 30 days without that, because all your tissues are used to the things that happen when you get aroused and ejaculate and aroused and ejaculate. And if you do that, you might experience tension or pressure, or going into this concept of blue balls.
I have a blue testicle right here for you, Taylor. It's from My Heart Guts. It's a little plush toy if you have anybody who can see this, but I use this for educational purposes. Anyway, it's actually blue. So I thought it was very fitting for this conversation.
Nice. Epididymal hypertension, I've heard, is this.
Exactly.
And so one thing, let's see how to phrase this question, do people ever come to you who have this regularly?
Yes.
And then what do you do or say?
Mm-hmm. So we actually have the conversation of, when can you start, there's an important, it comes down to the conversation of, are you willing to experience discomfort for all the other benefits that you're trying to do, whether that's semen retention or some other sexual practice, because you're not essentially hurting or harming yourself. It's uncomfortable. And for some individuals, because the epididymis houses mature sperm. And so the body naturally reabsorbs that and breaks down that DNA. But there is the immune part of it. Your immune system, actually macrophages and other molecules come up and break that down and clean things out, so to speak. So there's, to some degree, it might increase maybe some of the immune response or the inflammatory response, which again might sensitize visceral structures or visceral tissues, because you have nerves around these too. So yeah, it could be congestion for sure. People who have a vasectomy, some people have, chronic testicular pain or epididymal pain because, for whatever reason, genetics or, we really don't know what the causes are, why some men experience chronic testicular pain after a vasectomy versus not. But in some cases, it is inflammatory autoimmune, where the body is just not able to, work with the influx of, genetic material that's coming into this storage tank up on the testicles. So, yeah.
So it sounds like there's literal physiological stagnation that's happening because these fluids, whatever, build up, get engorged, and then you don't have the release that usually comes with an ejaculatory orgasm. So this is one really interesting area that I like how some of these esoteric traditions actually line up with the medical model, because in the tantric and the Taoist traditions, they speak to, they use the same word, stagnation. They say, oh, you're stagnated in that area of your body. You didn't actually allow the energy to move. And energy, physical stagnation, whatever, it's basically the same thing there. And so I guess hypothetically, it could be true that if you're somebody who is practicing semen retention and you're not doing whatever you need to do to move that physical or energetic stagnation, that possibly it could add to more tightness, more epididymal hypertension, possibly inflammation of the prostate.
Right. It could be,
Yeah.
because you have fluid. The prostate, actually, the seminal vesicles, which are two organs that are located on the back of the bladder, they house 70% of most of this of semen. It's actually proteins, enzymes, protective fluid that protects sperm. Sperm in itself is just 8 to 10% of your actual ejaculate volume, not much. And then the rest comes from your prostate gland. So, all these structures, again, because there's a rise in energy, a rise in constriction and pressure, just to help with the ejaculatory process to get that ejaculatory duct to open. Yeah. There's a lot of contraction, relaxation to build up, and so all these structures are involved. And when that doesn't happen, it can be for some people painful or irritating, but it really does depend on how you're introducing something new, like an activity to your body. If you're starting slow and you're working your way up, your body will have an easier time adapting to that particular process.
Yeah. So can I see this diagram?
Yeah.
This is, it's interesting to see this out of context to the rest of the diagram, but the urinary duct also good. This is also
that's the penile urethra.
Okay, this is the urethra. Great. So I've heard from more than a handful of guys actually who are practicing semen retention who say that they've actually had a difficulty or experienced challenges around urinary flow. And so I'm wondering, is that possibly because of an inflamed prostate?
Well, it could be inflamed prostate, or because you have the urinary sphincter, which is skeletal muscle, part of your pelvic floor, that's at the apex of the prostate, which is the bottom of the prostate. And then you have the bladder neck, which has the internal urethral sphincter that's not under your control. It's actually autonomic nervous system, which is also the system that is responsible for all these reflexes we're talking about as far as ejaculation. So in order for you to ejaculate out of your penis and not into your bladder, there's a symphony of things that have to occur very quickly, which means the bladder neck has to get a message to close, the external urethral sphincter has to open, and the muscles around the prostate have to squeeze, and that emits the fluid, right? But when we're stopping that process inadvertently, think about, like, if you're trying to pee and you stop the flow of urine midstream and then you go and you keep doing that.
Yeah.
What happens to the coordination and the neurological feedback loops? It starts to diminish at their role. Like, oh, you're telling me to do one thing and then it doesn't happen. Okay. So that might actually lead to perhaps like I said, a neuromotor dyssynergia of some sort, or just it could lead to habitual tension, guarding, congestion, like you said, inflammation. But I don't really know to what degree. Again, I'm kind of saying this arbitrarily as far as like inflammation and what that really means for someone.
Hypothetically.
Yeah.
So in the traditions that talk about this being a good idea for men to do, they all say that you need to be doing practices if you're going to be having sex and not ejaculating, practices to integrate that into the rest of your body or to reduce the stagnation. Maybe that's self-massage, maybe it's stretching, just something like that. And if you don't do that, then you are going to experience pain. Right. And I encourage guys to do this too. Everything from Qigong to self-massage to self-prostate massage, just to keep things literally just physically moving. Even if you don't believe in the concept of energy, just get things physically moving in that part of your body. Nitric oxide and erections. I've heard that if we breathe through our nose more regularly than our mouth, that actually increases nitric oxide production in certain parts of our body. Have you heard that? Do you counsel men around this?
So I don't have, I guess, in my wheelhouse of knowledge, the research or literature. I haven't dove into that. So I don't have a clear answer for whether or not breathing in through our nose in particular. I do know that from like a spiritual meditative, as a meditator, from a spiritual perspective, it is encouraged to breathe in through in and out of your nose. And I don't know what the science is behind that. However, I will say that when we're breathing in and out through our nose, it does require us to slow down our breathing, because the aperture of like the airflow, like our mouth is bigger and you have an ability to kind of breathe faster with your mouth open than closing your mouth and like having to breathe in and out of your nose. It like literally causes you to like slow down and slow your breath, your respiration rate. The other thing with erections, nitric oxide. So your nerves, when stimulated psychogenically or with genital stimulation or both, will release nitric oxide to help relax the arteries. And then the arteries allow blood to go into the penis. And then the cavernosal tissue, so your erectile tissue, which is corpora cavernosa and corpora spongiosum, it's like hot dog in a bun. Those tissues fill up with blood and engorge. And during that pressure, that process, the penile pressure increases and then basically presses on the veins. And that causes venous occlusion. So that prevents retrograde blood drainage, right? So that's a process of like nitric oxide and so forth. But physiological relaxation is necessary for erection because that stimulates the parasympathetic nervous system, which is the rest and digest and the relaxing nervous system. That is important. And I do talk to men about physiological relaxation and putting pressure at the door, like performative pressure at the door. That's so important because that is actually going to accelerate your ability to have an erection. The sympathetic nervous system is responsible for ejaculation. That's a fight, flight, or freeze, adrenaline, norepinephrine, all of those. That kicks in at climax. So when that sexual energy goes. So it's important to know what processes of this I guess of an erection, the sexual response cycle is involved. So in order to get an erection, parasympathetic, so relaxation, have to be physiologically relaxed. That allows blood flow, circulation to the tissues, etc. And then when you're ready to climax, to ejaculate, muscles tense, around the pelvic floor, sympathetic nervous system kicks in, boom, lift off. Yeah. So that's what I can say to your question about nitric oxide and blood flow. But parasympathetic stimulation is the driving factor.
Awesome. So that lends even more evidence to the practice of breathing deeply throughout sexual intimacy for the sake of lasting longer in bed, right?
Yep.
Because if we're that's stressful and could lead potentially.
And premature ejaculation is another one.
Yeah.
That's so important. To breathe and slow down.
Exactly. Well, I'm glad we got that last question in there.
Thanks for asking.
Yeah, that's awesome. So in closure, it sounds like you have a really awesome course for men around pelvic pain, and that's on your website. I've got a course that I'm creating right now coming up around anal pleasure, all things anal. And so if you want some tools and techniques to explore that part of your body, there'll be some sexual practices and some also just self-therapeutic practices in that realm. And hopefully I might actually do another interview with you about that at some point.
I'm game.
And and remind us all where we can find you.
So my website, drsuzieg.com. I'm on YouTube and Instagram.
Great. And we'll put all those links in the show notes. Thank you, Susie, so much for being here. It's been a treat to share this conversation with you. Thank you, everybody listening. Check out Susie's stuff. She's awesome. And I hope you all have a beautiful, beautiful rest of your day.